Hello, and welcome to today's webinar on services for older adults and adults with disabilities. My name is Lucy Gerland, and I'm a caregiver specialist with the Fairfax Area Agency on Aging. You should have received an email this morning with the speaker's slides, so you will have them for reference in the future. It is not necessary for you to have those open during the presentation. You can ask a question at any time by typing it into the question box on your panel. Today's presentation is being recorded, and the recording will be sent to all registrants by early next week. There will be a brief survey as you sign out. Please help us by giving us your thoughts, and please join us for future webinars. And now on to today's speaker. Today we have with us Catherine Choi from the Fairfax County Adult and Aging Adult Disability and Caregiver Resources Program. So this is the first place that we send people to when they need information on things that can help them in Fairfax County. Catherine has a wealth of information on this topic and on these services. She's been with Fairfax County for over 6 years. She has her bachelor's in social work from George Mason University and her master's in social work from the University of Maryland at Baltimore. She also has experience working with the intellectual disability population, working in group homes, inpatient psychiatric hospital, medical settings, the school system, and once again, she has been with Fairfax County for over 6 years. So she has a very broad range of information, and she's going to share some of that with us today. Catherine, thanks for being here.
Thank you, Lucy, for having me today. Now, as you are listening to today's program, because some of you are trying to navigate in preparing for either yourself or for someone else, we have a whole group of different people who are listening to today's program. So regardless of who you are, know that one thing, most importantly, that you can pick up the phone and talk to a county social worker. If you haven't already checked out our website, if you go to Fairfax County Services for Older Adults, this is the picture that you'll see at the beginning. And as soon as you see this, you will be on the right site. And we understand that not everyone is comfortable using the computer. So any information that you need, if you need a hard copy, a physical copy of any of our information, please feel free to give us a call and we can mail those out information to you. Now, if I am going over a whole bunch of information, and if there's anything that you really, I want you to take back with you, is that just remember at least our phone number, because there's so much information. I'm not going to expect you to know everything. And during this webinar, I will welcome questions as I go along. So if you have questions, please jump in. Let's make it interactive. Now, 703-324-7948 is the Aging Disability Caregiver Resource Line. It is a must-answer line. So if you're not comfortable speaking in English, we will provide an interpreter. As long as one calls between 8 and 4:30, Monday through Fridays, when you call, you will get a live social worker. It's kind of funny because sometimes we even get calls who are callers who are surprised to hear that they're actually speaking to a live voice and they haven't gone into an answering machine. Not only are we a resource line, but we are also the intake line for some state and local government programs. This is just a sample of the type of calls we receive. Last year, more than a third of our calls were consultations. And the second were adult protective services, which were like whether reports or questions regarding a situation that may be adult protective services related or APS related. Even if you're not exactly sure what type of help you're looking for, our trained social workers will listen to your story and hear what's going on. The ADCR line, and I'm going to use that word interchangeably, ADCR with Aging Disability Caregiver Resource Line. It's a mouthful. We work with those who are in need of services for county residents who are 18 years and older. So again, for 18 years and older. And throughout this talk, I will give some examples of some of the types of calls we've gotten to. And of course, there's a whole bunch, but I'll just give some examples, try to make it real to you all. An example of a call I might get is a neighbor or a friend may be calling stating that they know of an older person and who needs some help. It could be very general, but we will talk to them, get some information, and if need be, we can ask them possibly to have that either person who needs the help or maybe a family member call together with them. Another example of a kind of call we would get may be a person who is in poor health, and let's say they had a stroke and the daughter is just feeling overwhelmed and they don't know what to do or what type of help there is out there. This is just some example of the type of calls we get. And this is just some more examples of the type of calls we receive here at ADCR. We also refer to some private and non-for-profit organizations that provide services for older adults and adults with disabilities as well. I mentioned earlier that our second highest volume of calls are the adult protective services reports, or maybe even consultations on adult protective services situations. Adult Protective Services is a mandated program that receives and investigates reports of abuse, neglect, and exploitation of vulnerable adults. And by vulnerable adults, we're talking about adults who are 60 and over, or those who are 18 to 59 who are incapacitated. Now, one may wonder, what is an incapacitated person? An example would be someone with an intellectual disability or an adult who lacks sufficient understanding to make or communicate or carry reasonable decisions regarding their well-being. APS receives reports. So we'll receive the reports and we will determine if it's a situation where APS can get involved. And then if we do get involved, we have 5 days to start an investigation. When one makes a report, we'll determine if it meets the state regulations for that investigation. An example of a caller I had regarding an APS situation not too long ago was a home repair company, and the owner of the home repair company called and just expressed some concerns about one of their employee who went out and saw an elderly person, how the home environment was, and seemed as if that person needed some help. Now, when I spoke with the owner of that company, they had very little information, but I could truly hear the concern in their voice. I did talk about, yes, it does sound like there's some concerns. So if that company owner could speak with their employee who was actually in that home environment to give us a call, and then we could get a better understanding of what was going on in that home. And that company agreed that that would probably be the best plan to do, give us a call from that employee standpoint of what they saw and the concerns are. You may ask, who should make an APS report? Now, anyone can make an APS report. And I want to emphasize that when someone makes a report, their name is kept confidential. So we never disclose who called us. Anyone may call to make a report, but there are some professionals that are mandated reporters. And in the state of Virginia, some mandated reporters, the examples are like mental health service providers, guardians, conservators of an adult, emergency medical service personnel, law enforcement officers, or licensed and certified professionals are just some examples of mandated reporters in Virginia. But know that anyone can make a report. When needed, APS partners with other agencies. And one of the examples would be we do partner with law enforcement. Unfortunately, with all the financial scams that's been going on with the older adults, law enforcement at Fairfax County has developed the Silver Shield anti-scam campaign. And if you're interested in finding out more information about the anti-scam events, please check online or give us a call and we can look at different outreach programs they have as well. Now, the goal of APS is to stop abuse, neglect, and exploitation by protecting the adult with the least restriction. APS does have limitations. APS cannot force protective services upon an adult who has the capacity and refuse services. So an adult, as adults, we all have rights, and sometimes our choices may not be the best choice we make. So, so that is the limitation. Sometimes people call APS and want certain things to happen to the older adult or the person with a disability. But depending on their capacity, we would have to take consideration what our limitations are. Our local APS hotline is 703-324-7450, and we receive reports from 8 a.m. to 4:30 p.m. Monday through Friday. After 4:30, those calls rolls over to the state hotline, and those reports from the state will be retrieved in the morning by the appropriate counties, and the local jurisdictions will review the reports. In-home care makes it possible for seniors to live safely in the comforts of their home. And these are just some examples of in-home care: the home-based care, ElderLink, and home care registry. Fairfax County's in-home services is a program where county worker will conduct a functional and financial assessment to determine and help provide appropriate services for an individual so they can remain safely in their home. And this can include help as bathing or housekeeping or laundry. An example I can give you is someone may call and say a parent has Parkinson's, and after hearing about the type of symptoms they're having, and we realize that the Parkinson may not be too advanced at this state, but they need some assistance getting in and out the shower or the bathtub. You'll hear a lot of frail people falling when they're going in and out of the tub. And if this assistance can help someone to stay safe in their home, this gives the individual the freedom to make the choice to live safely in their home. So this is an example of some of the services we can help provide or see if this is appropriate for that individual. By calling the ADCR or intake line, we'll start the intake process. After the telephone intake, a county adult services worker will be assigned to the individual in need, and they will schedule a time and see the individual at their home. The County Adult Services is a program that is for someone with a long-term situation or more of a permanent situation. So example would be if someone is having surgery and expected to recover, we may refer that person to the home care registry. And the home care registry, they are a list of private providers. They work independently and they may be more affordable. The private providers, they have been screened by a Department of Family Services worker. It's pretty amazing. The home care registry is approximately 50 pages. Every one of them have gone through an interview, have filled out an application, have gone through some background checks, and that registry is updated almost monthly. So if you would like a copy of the home care registry, you can either give us a call at the 703-324-7948 number, or you can also find it in our webpage. Now, ElderLink is a nonprofit partnership that was established in 1989 between Innova and the Fairfax Area Agency on Aging and the Alzheimer's Association, the national chapter here locally. Typically, we refer to ElderLink when they're over income for the county program. And these are just some of the programs ElderLink has. So ElderLink coordinates the care of older adults, trying to maximize independence and safety in their home. ElderLink also supports family caregivers in their caregiving role, and they also assist them in maintaining their own health and well-being as well. So not only are they trying to take care of the ones who need the physical help themselves, but also the caregivers, because caregivers definitely need support as well. Some programs that are offered through ElderLink are caregiver consultation, a home safety assessment, health and wellness programs. And the cost is based on a sliding scale. So you can give them a call to see if this is appropriate program or service that may be helpful for you or your loved one. Fairfax County has a caregiver support program, such as seminars for caregivers, caregiver support, telephone support groups, and we also have a monthly newsletter containing information of interest to caregivers, including local educational events for the caregivers as well. Now, one can register online for the telephone support groups. If you go to the Fairfax County Adult and Aging website, if you have further questions about how to get onto this telephone support group, you can call at the 703-324-5376, and they can also help you register for the telephone support group as well. Meals on Wheels is a program that provides a balanced and nutritious meal for eligible older adults and adults with disabilities who are homebound, unable to prepare their meals, and they must have no support available to provide or prepare their meals. And they must be able to remain safe at home with Meals on Wheels as a support. To request or inquire more about Meals on Wheels, please call their intake number at 703-324-5409. And after a referral is made, a Meals on Wheels worker will be assigned to the individual. Now, people ask about the cost. Meals on Wheels is not a financially based program. So it's based on their functional needs, but one may make a donation for their meals. Volunteers are very valuable to the Meals on Wheels program. Not only are they delivering the meals, but they also help bridge the concerns they see. An example would be when a volunteer is taking food to an older resident and the volunteer sees some concerns about the resident, they may contact the assigned Meals on Wheels worker, and then that Meals on Wheels worker would make contact with the individual and see what's going on, if there's any other concerns or things have changed within that individual's situation since that Meals on Wheels worker has last seen them. Senior centers are for active adults, which offers opportunities to make friends, stay on the move, and learn new things. And senior centers offer classes and health and wellness programs as well. They offer trips and other opportunities to socialize with others and try to stay connected to their community. Some example I get about senior center questions is adult children may call and say, my parent is bored at home, they live alone, and they're just trying to look at into different things for the parent to do. So depending on what their situation is, what their health is like, we may refer to the senior center. At the senior center, they have a nutritional meal that is served for those who are 60 and above, and that is with a donation based on age and income. And that program for the meal is called the Congregate Meals Program. Transportation options are available. So if one is not able to drive anymore, you can contact us at 703-324-7948, and we'll be more than happy to see which senior center will be the most closest to the individual in need.
Catherine, I do have a question
Yes,
about the senior centers.
sure, I'll go back.
Okay,
Yes.
it's actually two short questions. One, do you have to go to the senior center closest to where you live?
So the question about going to the closest one can go to other senior centers that are not closest to their location. But if you need transportation, transportation is typically provided to the one that is where the closest to their home is. Does that make sense?
Yes, and once you have a membership to one senior center, can you go to other senior centers, or do you have to individually belong to each one?
You know, that's a good question. I believe once someone is a member, it is a member across the board, but honestly, I'm not sure about that. I can look into it,
Okay, all right. And
and yeah, I
yeah, we
think
can answer that question through email.
yes, so definitely the person who's asking this question about membership, please give us a call because I don't have all the answers and we have so much resources that we're always trying to gather new information as well too. So please give us a call at the intake number at the 703-324-7948 and we can answer that question, okay?
Great. I do want to reiterate that when people call us for information about services for older adults, caregivers, or people, persons with a disability, we send them to that number because that is central, and they do have the of really well versed. They're well versed in all of the things that you can have access to. So that really is what we call our first line and our one-stop shopping there. So, and the other question that I had is you can join a senior center at age 50, but the meals are not until age 60.
Yes, yes, that's correct. So, yes, so at 50, one may join the senior center, but 60 is the congregate meals program starts at age 60.
All right. Thank you very much.
You're welcome. Okay. Okay. The adult daycare program, this program is for those who are frail and elderly, for adults who need supervision during the day. An example would be a caller states that mom is taking care of their dad, and it's just getting too difficult for her to take care of him all day and night. And after we get more information about the individual, we may look at different options, but adult day program may be an option where they can go to a day program, still live in their community, in their home, but this also gives the caregiver some respite as well when the person who needs the care is at a safe place. And adult day centers are for individuals who are more of a nursing home level of care. So at the adult day centers, there are multidisciplinary team of professionals that are there taking care of the individuals. So again, it is different than a senior center. These are not for the active adults, but those who need care. There are 4 adult day centers that are county run. Of course, there's private ones as well. And you can call the intake line at the 324-7948 to see if this is the right level of care for your loved one. We may recommend sometimes an individual going to an adult day program, but there are times when whether if someone may qualify for long-term Medicaid, we would be the starting point to start that intake and process to get approval or not and be assessed for the long-term Medicaid for adult day programs as well. Now, disability services helps one learn about disability rights and advocates for improved access and to be fully able to participate in the community. Disability services also helps by providing resources. And disability services believes that people have rights. If you believe that you've been denied access to services because of a disability, or you would like to know what your rights are, you can contact the 703-324-5421. An example of a call may be someone might call and say, I'm having some issues with my employer and I'm not sure if they're discriminating against me due to my disability. So that could be just one type of example, but we are open to getting calls and hear what your concerns are and see if disability services would be able to help you out and guide you throughout this process. The Northern Virginia Ombudsman Program helps long-term care recipients like nursing home cares or hospice, adult day health care, assisted livings, and nursing facilities. The cornerstone of Ombudsman program is working towards residents' rights. This program is a federally mandated program, and every state does have an ombudsman program. So every long-term care facility resident does have access to an ombudsman. All the complaints and issues with regards to are regards to resident care or life. Now, some examples of a type of complaint that are received may be poor staff attitude, poor hygiene, medication error, poor call bell response, and there's a lot more. Sometimes there might be a confusion or a gray line. Would this concern be someone I call for Ombudsman program, or should I call Adult Protective Services? And sometimes we do partner with Ombudsman as well. But when in doubt, give us a call. We can talk to you at the Adult Protective Services hotline and see if this is something that Adult Protective Services needs to get involved, or if it's solely something Ombudsman would be involved in. Usually the complaint may be more of a systemic type of nature. So when there's something going on at the facility, we may refer back to the Ombudsman program. The Ombudsmans, they train and their supervisors, volunteers who regularly visits facilities and they advocate for resident rights. Now, this is a free and confidential program, and ombudsmen, they go heavily relying on their volunteers as well, just like our Meals on Wheels program. So if you're interested in volunteering, please call 703-324-5861 if you're interested in working with seniors and seeing how you can give back to these vulnerable adults.
I do have a question about the Ombudsman program.
Okay.
How can caregivers benefit from contacting the Ombudsman?
Sure. So if a caregiver has some concerns for their loved one who is in a facility, those are the main kind of concerns that ombudsmen receive. So if their concerns, say mom or dad is living in a nursing home or assisted living, the person who is in need typically would need to call the ombudsman and whether make a complaint. The ombudsman works as negotiators. So whether the caregiver wants to be involved, and hopefully there are family members who wants to be involved. So certainly you can get involved that way. I hope this answers the question.
All right, thank you. I have another question here.
Sure.
I have been a caregiver for the past 3 years, but I wasn't able to work. We used our 401k and all our savings for medical expenses. We cannot even afford all meds anymore. I have heard about a paid family caregiver program. Where would I have to start to get paid to be the caregiver of my husband? And before you answer, I just want to put in here that this is exactly one of the reasons why we would suggest that you call our Adult Disability and Caregiver Resource Line, because this question is about one thing, which, Catherine, please address,
Mm-hmm.
but there may also be some other things that the person who's asking this question is not thinking about that our ADCR social workers would be able to point them to. Is that making sense, Catherine, what I'm
Yes.
saying?
Yes, and
So,
this is an excellent question. I actually receive a number of calls like this when they are taking care of their family member, and like you said, you have are paying out of pocket, and whether you're paying for a caregiver or whether one is paying for someone to be in assisted living or a nursing home, the cost is very expensive. And honestly, I don't know how people can afford to continue to pay. And like Lucy said, our Aging Disability Caregiver Resource Line, that's 703-324-7948. So that number, not only do we do consultations and can kind of guide you through different programs and make recommendations, we also do the intake for some state and local programs. So if the caller who asked this specific question, please do give us a call at the intake number 8 to 4:30 Monday through Fridays, and we'll hear more of the details of what's going on. because if they are in need of some programs and possibly can benefit from them and qualify for them, we would do the intake at that phone number. We start off with a telephone intake. After the telephone intake, a social worker would be assigned to the individual in need in the next couple of days. Once the worker is assigned, they will call the individual or family representative, and they will schedule a time and they'll go out to the home to do the face-to-face visit. But it all comes back, the starting point has to be at our ADCR/intake line, the 703-324-7948 number. Yeah.
Yes, agreed. And back to the original question, though, does Virginia have a paid family caregiver program?
So there is a program um, where, so is it specifically that the families get paid? There is a program that they have to qualify first. There is a functional and a financial screening for that program. Now, if they pass both the functional and the financial, they would then, there are other, what we call different agencies that they can go through in order to be paid. So the answer to that question is yes. Can a family member get paid? Yes, but there are process to that, and it has to originate through our intake line if they are in Fairfax County.
Okay, that was so important. I'm really glad that somebody did ask that question. Thank you.
Yes, and you know, one person may be asking a question, but I'm sure a lot of people are probably wondering the same thing. So please don't hesitate. Just jump in, ask questions. I'll be more than happy to try my best to answer it. If I'm not able to give the answer, give us a call at the intake line and we will address it specifically, what your specific question is, and go from there, okay? So our next slide is on the ViCAP program. ViCAP stands for Virginia Insurance Counseling and Assistance Program. And ViCAP are trained volunteers to help older adults understand Medicare rules or HMO plans, Medigap policies, and long-term care insurance. So if you have questions regarding how one's insurance works or Medicare works, please give ViCAP a call at the 703-324-5851. Now, they do most of their work by phone. Sometimes I know people like to come in and meet face to face. So please don't just walk in. Please call them, make an appointment if you do want to see someone in person. A typical call, a lot of times we get callers saying, I'm going to be retiring soon, and I'd like to find out which insurance um, would be best for me, or when do I need to apply for Medicare? So these are some typical type of questions that I've received in my experience.
Yes, I also want to note that we do have a Medicare webinar coming up. And so that would be registering the same way you registered for this webinar. And I'm frantically looking for the date here. It's Wednesday, October 9th at noon. So many people who have already signed up for this webinar may have signed up for the Medicare one. But just in case, it's the same way that you signed up for this webinar, and it's Wednesday, October 9th at noon. And that's going to be with one of our very, very experienced ViCAP counselors.
Yes, ViCAP, I mean, they're such a great resource, and they offer presentations for local groups as well. So this is just a picture of one of the presentations that they were giving. And So assisted livings and nursing homes. Adult and aging, we also help those who are in need of nursing home or assisted living placements. An example would be a caller would say possibly mom has been living in an assisted living facility and is running out of money to continue to live there. So that's kind of a typical call we get sometimes. And so we can talk to them what they need to do, what programs needs to be applied for in order for the loved one to be in a safe place. The county can provide information, resources, guidance, and different screenings to see what's most appropriate for that individual at their level of care. Another example of a caller would be someone, it's funny because we get a number of calls. Someone would say, I'm interested in a nursing home or assisted living for my mother-in-law, my father-in-law. Now, one may be interested in placement for the older adult for themselves, but know that the county will not be placing them without the older adult has to be interested in placement, and then they can call us and we can talk about different options with them. So again, the person who needs the care, they have to be agreeable to the services. The federally qualified healthcare health centers, formerly known as Fairfax County Community Healthcare Network, and this name changed in the summer, not too long ago. It's a partnership of health professionals and the government, and these centers were formed to provide health services for uninsured or low-income residents of Fairfax County. The county health department, they operate 3 health centers. One is in the Merrifield, Fairfax area, one in Alexandria, and one in Reston. And these clinics, they provide the kind of medical care that's typically offered in like a family doctor's office. And to find out more and see if someone you know is eligible for this program, you can certainly give our intake line a call and we can talk to you about which location is the closest for you. The CSB, also known as Community Services Board, it's a public agency that plans, organizes, and provides services for people in the community who has substance abuse disorders, mental illness, and developmental disabilities. And state law requires every jurisdiction to have a CSB. So some of the providers of a CSB includes like psychiatrists, psychologists, nurses, counselors, therapists, support staff, and case managers. This is a great resource for someone who may need either mental health services or intellectual disability. I would say an example of a call that I have received that I've referred to a CSB number would be a caller would be a 45-year-old cousin who has intellectual disability, and the family is just looking into different group homes since the parents are getting older, and the family is wondering what should they do, how can they have stuff lined up for that cousin who has an intellectual disability, so when their parent passes, they can be taken care of. So that's just one example. Now, as one gets ages and driving becomes more of a challenge, getting rides to different medical appointments or errands become more challenging. And there are some resources in the community. So please give us a call at the intake line and we'll be more than happy to talk about the different resources and see which type of transportation resource would be most appropriate for the individual in need. So these are just some examples of fast tram, metro access, the taxi program, and also we refer to community nonprofit organizations as well for transportation. Now, I've covered a lot of information, and this is, and the examples I've given also, it's only a glimpse of the type of calls we receive. Every situation is very different, and on this kind of platform, it's difficult for me to just give every example, but know that you can give us a call, and we have a live social worker to answer your call, answer the questions. We will try our best to answer, and if we don't, we will at least try to guide you through this process. Like I said at the beginning, I've gone over a lot of information, and if there's one thing you can take back from this webinar, is our phone number. Give us a call, and you will have a social worker to listen to you. We'll have an open ear, and try to figure out this situation together. And if there's any other questions, I'm more than happy to answer them.
All right, so attendees, if you have any questions, go ahead and type them in now in the questions box that you have. I have been asking as we went along, Catherine, so you know,
Sure, yeah.
yeah, and that was a lot of information. I think we are just so fortunate to live in Fairfax County. So one thing I would like you to address is, do you have to be a Fairfax County resident? Do I have to be a Fairfax County resident to call you, or does my loved one have to live in Fairfax County in order for me to call you? What
That's a
is the
great,
requirement? Mhm.
yeah, that's a great question. So as far as our program, the person in need needs to be a Fairfax County resident. So if you brought your loved one here from another state, another county, and the day you bring them, they are considered a Fairfax County resident. So, some people ask, well, do they have to get a driver's license changed or their ID changed? No, that we're not going to be looking at that. Just give us a call, and as long as you have brought them here, we can talk to you about the situation, about what's available for them here. Now, sometimes we do get calls about people, the caller may say, I live in Fairfax County, my loved one lives in a different state or a different county, and I want to bring them here to be closer to me so I can take care of them as they age. And we get those kind of calls where they want to find out what the different resources are. And we welcome those calls because we can get a better understanding of the individual in need. What is their health condition? What kind of financial resources do they have? And it might help the individual to determine if they want to move the person here or not. And so um, yes, so the answer is they must be a Fairfax County resident. But if you're thinking about moving them here, please give us a call too, and we can try to guide you through that.
All right, thank you. I did get another question. I don't know if you'll have this off the top of your head, so I'm kind of looking at the Fairfax County website, but the
Okay.
question is, what are the 4 locations of the adult day health centers?
Oh gosh. Off the top of my head, oh
Yeah,
gosh, you're testing me. There's one in Herndon. There's one in Fairfax. There's one in Alexandria. And I'm going blank on the third one. Um, I almost want to
yeah,
say there's two in Alexandria, but I am not positive right now.
that's
Um,
why I can do a little search quickly on my computer, but even at that, if you go to fairfaxcounty.gov, I would say, and type in adult day health, you're going to get all those locations. But they are, as everything in Fairfax County, being, Fairfax being such a large county, um, we spread things out. So we need to have one in the north part of the county, right? The south part of the county, and all that. So I would say um, uh, Herndon, right? We have one in
Yes,
Herndon. I found that. Lewinsville.
and that is, I believe, the Fairfax area.
Yeah, that's the saying McLean. But
Mm-hmm.
the best way to get their specific locations and addresses is to go to fairfaxcounty.gov and pull that information up, or call. Go ahead, Catherine, one more time with your phone number.
703-324-7948. Um,
Perfect.
yeah,
Yeah.
and even though there are 4 county-run adult day programs, there are other privately owned ones as well. And the reason I do suggest that you give us a call is because the cost. So that, and I'm surprised no one asked about the cost. So um, depending on one's income, it could be where they have to pay the full amount, and I don't know the cost offhand. Or it could be on a sliding scale, or if the person has a functional and financial need where they qualify for long-term Medicaid. Again, that intake is done through our line. So giving us a call would be helpful to see if finance is an issue, to give us a call and see if that's something they want to talk about. If they want to just go and visit some, I encourage you to go and visit some of the adult day programs, and maybe take your loved one with you and see if that's appropriate level, or if the loved one feels that they are comfortable going there as well.
Right, because there is a cost even to the county one. So just because something is run by Fairfax County doesn't mean that there are no costs involved.
Yes, yes. So,
Yeah.
yes, so depending on their income, whether one pays full amount or on a sliding scale, or if someone qualifies for long-term Medicaid, again, they would have to give us a call to start that intake process.
Yeah. All right. Well, let me just double check one last time. Okay, uh, I did have somebody respond with the 4 locations. She works
Oh,
for the
okay.
Area Agency on Aging, Herndon Harbor, Lewinsville, Lincolnia, and Mount Vernon.
Oh,
But
thank you.
still,
Thank Yes.
yeah, I mean, as we keep coming back to, please call the ADCR line, because there may be options that they know of that you're not aware of yet.
Right.
And, Fairfax County has such a great range of resources available. So, um, with that, I would like to thank Catherine for sharing all this with us. And I would like to thank everybody here for coming to the webinar today, and please come to future ones. As you sign out, there will be a brief survey. So if you could respond to the survey, that would really help us provide, good and useful webinars for you in the future. Thanks again, everybody.